Good morning, everyone. Could we have everyone grab a seat, please? I'd like to welcome you and thank you for attending this workshop on incorporating weight management and physical activity through the cancer care continuum, regardless of whether you're here in person or via the webcast. I'm not Mike Caligiuri. I just play him at workshops when he can't get into town. I'm Ed Benz, becoming in his chair of the forum tomorrow, actually. We're delighted to have you here. I have just a few words to say about the forum. I know many of you are not only familiar with it, but that you actually have supported us through your work. Excuse me if I read this, but I do want to be sure that we get the information out correctly. The National Cancer Policy Forum serves as a trusted venue in which experts can work collaboratively to identify emerging high-priority policy issues in cancer research and care, and to examine those issues through convening activities like this one that promote discussion about opportunities for action. The activities inform stakeholders about critical policy issues through published workshop reports and often provide input for formal consensus committee studies. The forum provides a continual focus within the National Academies on cancer. The forum addresses issues in science, medicine, public health, and public policy that are relevant to the goal of reducing cancer burden, both through prevention and by improving the care and outcomes for those diagnosed with cancer. So this workshop today serves all of those purposes, and I'm sure it's going to be very interesting and stimulating. I'd like to thank all those who've put a tremendous amount of time into organizing it and who will be presenting and be discussants during the course of the day. Our workshops are sponsored, and I want to take a moment to thank the sponsors for their support of this activity today. You can see them listed on the slide, and especially I'd like to thank the Planning Committee, chaired by Wendy Demark-Wahnefried, who's going to take over for me here in just a moment. So I hope that we all have, as has been true in the past for our other workshops, a very interesting, stimulating discussion, clearly about an important aspect of health as well as of cancer care and management. And with that, I'll turn it over to Wendy, and thank you for your attendance. Wendy.
Thanks, Ed. So I want to reiterate our gratitude to our sponsors and our terrific cast of speakers who you're going to be hearing from, and also to the audience. We have a lot of experts in our audience, and I regret that the snow is keeping some of our speakers and some of our audience away, but I know that they're going to be joining us on the webcast, so that's all good. So back in 2011, we sponsored the workshop that was entitled The Role of Obesity in Cancer Recurrence and Survival, and many of you were either there as speakers or there in the audience. It was really successful. It gave rise to two high-impact publications, but more importantly, like a lot of national cancer policy forums, it gave rise to interest in the community to really start to spur some effort. And I don't know if we can take credit for it per se, but what the heck, why not? ASCO soon came out with their position statement. Jennifer Ligabell's here, who led that very important paper, and that very important initiative. And I'm really hoping that this workshop also spurs some very important efforts that are just need a little bit of oomph to get going. This workshop is aimed far less on the biology, far less on the mechanisms of obesity, and much more on what we call dissemination and implementation, the D&I part of the equation. So as far as what our aims are here, Our aims are to highlight the current evidence base, gaps in knowledge, research needs related to physical activity and weight management after the diagnosis of cancer, and you can read the sub-aims below, as well as to examine the opportunities and challenges for weight management and physical activity interventions. And again, read the sub-aims below. Here is our agenda for today, so we have a lot of ground to cover. And here is our agenda for tomorrow. So we have a lot to do over the next 2 days. And as in all National Cancer Policy Forums, those of you that have been here know. Those of you that don't, let me acquaint you to the procedures. So we really do value the audience participation and have a lot of, we have ample time for discussion. And many of the important points are brought up during that time. So if you have a point or if you have a question, please make your way to the microphones, introduce yourself and your institution so that we can capture that all on the tape. Now, we're starting off with a session called Prioritizing Patient Voices. And we all know that cancer affects everyone. It affects the rich and famous, and some of those celebrities are listed right here. And those celebrities do provide us with some very inspirational stories, inspirational quotes. And my personal favorite is by Michael Douglas down here that says, "Cancer did not bring me to my knees, it brought me to my feet." And I think that's something that each of us in the audience, that's our mission, to get cancer survivors back on their feet and back to hopefully where they were before their diagnosis. So, but the goal of our workshop is not necessarily for celebrities. Celebrities can kind of take care of themselves. They know where the resources are and they have the means to pursue them. Instead, we're after people, everyday people, and our mission is to really bring the patient the care and the support that they need. And in this case, physical activity, get them back on their feet, give them the tools that they need for healthy weight management so that they can really improve the quantity and quality of their lives. So we're going to start off with two, they're not celebrities per se, but they're very extraordinary people. And they come at the cancer survivorship perspective with two very different perspectives. One is Karen Cochran, and I'm hoping that she's in the listening audience. Karen was diagnosed 4 months ago with early stage breast cancer. And then we have Robert Harrison, who's with us here. And Robert was diagnosed 14 years ago. He is not a cancer survivor, but a cancer thriver, which is how he labels himself, and we want to make more of Robert. He comes from the perspective of having metastatic prostate cancer right from diagnosis onward. So two very different patient perspectives. Karen is not able to be here. Her oncologist advised her not to travel. So she prepared her video that we're going to listen to. And I want, as we listen to her video, she does reference being in a study as helping her tremendously. And but she does bring up some very important points of being in that study as far as self-monitoring opportunities, what kept her on course, that she does bring to this audience here. However, I want to reiterate, we cannot rely on studies to get patients the care that they need. We need to provide physical activity and weight management as a part of standard of care. And that's where we're going with this workshop. But again, her points are very well taken. And I think now, Cindy, you want to play the video?